Recording in progress. Sonya, you're good to go.
Welcome, welcome everyone to the official podcast of Dentistry Gone Wild. We're so excited to be here again today, as usual, on a Monday, bringing you the best that dentistry has to offer.
Come
And
on, people.
today, and today,
Stay close.
I love
Get
this
in.
guy.
In fact, if you're close by, get a little closer to your computer screen, or if you got your, turn up the volume because we got some stuff we're gonna talking about today.
This
Because
guy is the one. Melissa,
dentistry's
talk
gone
about it.
wild. What am I doing on dentistry's gone wild? I mean,
You know what?
How
We don't,
that
Sonya,
happen?
Sonya and I don't even need to be here for this. Like,
No,
he
let's
got-
be real. You guys, we have an amazing guest today, Dr. Chris Kammer, who is doing everything in dentistry and doing it
Everything.
well, and who's got a lot of good stuff to say too. I mean, I don't even know if we're going to get into how he runs his practice or oral systemic link. I mean, we could just
No, 'cause
have a good time, right?
it's gonna be too wild. It's gonna be too wild to bring it down and get all serious like that.
Right, right.
That's
I
for
got
and
songs to sing. I got a dance to do.
well, I was going to say you
I'm
have
gonna
some
do some
amazing
chin-ups maybe, but that's nobody wants to watch that. But anyway, yeah, let's talk about dentistry's gone wild. It has gone wild. I'll tell you what's
Stop.
wild about dentistry though.
What's wild about dentistry?
Well, they're still using drills out there. Okay.
Yeah, I told you. We were
Talk
gonna
about that.
this. Yeah.
I'm talking about that because I've opened an office with no drill. Yes, that's kind of shocking, but somebody had to do it. Can I get an amen, Sonya, Melissa? Somebody-
Amen. It's the amen
somebody-
corner.
Yeah.
you know we're all for that. Yeah.
Because how can you have a dental office with no drill? Well, you don't amputate tooth structure, and even if it's decayed,
Wait a minute. Did you say amputate?
it's a scary word. I know it's a big, scary word, but that is exactly what happens in dental offices all across America. Yes, they see a cavity and they only they only practice to amputate it, cut it out. And, they take a whole lot of healthy tooth structure with that as well. And then put in a filling. Why not use a medicinal approach? Yeah, like the medical community does. If we had an infected throat, we'd probably get, some antibiotic, right? To deal with our strep throat. But we have infected teeth. Why don't we deal with those with an antibiotic? And we can. It's called silver diamine fluoride. And,
Yes.
and we can do this, people. But you can't get dentistry to to back off the drill. Drop the drill is what I'm saying. Drop it.
The drill. Drop the
Drop
drill.
the drill. Drop the drill. Come on. We're going marching down the street after this broadcast.
Drop the drill.
Ladies, you with me?
Yeah.
All
Well,
right.
you
Doc,
know. Oh, go ahead, Sonya.
Em. But if you drop the drill, you drop money. Let's just be real. The drill equals dollar signs.
Oh, yeah.
So you telling somebody to drop the drill, and they have a staff to pay. You about to get a hygienist or a dental assistant fired.
Sonya,
You drop the drill, you dropping money. Let's just be real. Come on, Doc. Be real.
let's be real. Let's be real. I'm getting even more real than that. Dentistry is the most expensive education you could get. One of the most expensive.
Okay.
And setting up a dental office is one of the most expensive businesses you could ever set up.
Unless it's mobile.
Boom. Unless it's mobile, right? Unless it's mobile or it's yes, and you could call my practice mobile, really, because I could set it up anywhere. You don't need the overhead. You don't need you can do a lot of this by yourself, which is such a beautiful thing. I've got dentists coming to me who are ready to retire. They're going, I'm just going to step away from all that stress and noise and, sometimes the people and the teams and everything. It's got to get away. You can do this model all by yourself, all by myself. Do I want to be? Yes, all by myself from now on. Yeah, boom. Okay, enough singing.
We
but
only have 15 minutes, right?
here's
we
the
talked
point.
about that,
Yeah. Trim, edit the songs down, Kammer. Okay, it can do that. But anyway, yes, you can operate this model all by yourself, and it's probably it's a very similar way to how people go out on a mobile dental trip. They're mostly by themselves and can be by themselves. But anyway, yeah, so I might just be disrupting dentistry in the biggest way it's ever been disrupted. But it wasn't me. I just took it to a step farther. I mean, the SDF, the healing modalities are there. The ADA recognizes them. The FDA has approved the SDF medicine as being safe and effective to treat sensitivity. The studies are being done by the National Institute of Health. Within a couple of years, it's going to come out that SDF is going to be the first drug approved to treat tooth decay.
Wow.
You can have it now. Call this number.
$29.99, right?
Call this number, and we'll throw in. No,
But how much does a dentist get paid to apply that?
well, I think. Well, so I'm trying to show that this model can be that you can make. You can have a quote, air quotes, $1 million practice doing this healing modality. Now, when I say $1 million practice, and that used to be the benchmark, now it's probably even higher. I don't even know, but let's just use that as for an example. There's hundreds of thousands of dollars of overhead, of equipment, of this, that, and the other thing, rent, building payments, whatever, mortgage. Whereas this model doesn't have any overhead. You can do it by yourself. So you can eliminate all the overhead. In my model, I don't have suction. I don't have plumbing. I don't need water. I don't need suction. I don't need air. I don't need air pressure. Now, when I do need air pressure for to dry teeth off a little bit, I've got what is basically a garden sprayer converted into an air pump. Well, I pump, and
yeah, we know that. Yeah,
you know all that. You got the air everywhere. Marcus Duffin created that. But anyway, so there's ways of doing it different. I'm excited. Listen, ladies, I've been around the block in dentistry. I've done a lot of things. I've done very stressful, full arch, full mouth preps, all of that. I've done sedation dentistry. I've done implants, you name it. I think I've done it all. And now I am so enjoying moving into this peaceful space where you can just, you have time to actually talk to people and get to know them. And so the point I was trying to make is I have to prove to the rest of my dental community that you can be profitable with this model. But when you eliminate all of the overhead, there's a big
Right.
hurdle right there. And so it's almost no overhead. So every dollar that comes in is a dollar you can pretty much keep. And I think that's how I'm going to make it make sense. Mm-hmm. And so, wow. So I'm healing tooth decay. I'm doing Hall crowns. Mm-hmm. I have a patient came to me from Ohio. The family actually brought their little, not even 2-year-old daughter, did 4 Hall crowns on the front. The dentist in Ohio wanted to pull them or take her into the hospital and do all that sedated amputation of tooth decay and then put the crowns on. I said, no. We could heal it and then put the crowns on with no anesthesia. We can do it with no drilling, just healing and happiness and joy. That's all I'm trying to bring to the world, some happiness and joy in the dental space.
Peace, love, and happiness. That's it.
People thought it wasn't possible. They thought it wasn't possible. But I'm bringing it.
I know. I think we're all huggers, not fighters here on this call. But okay, so here's what I hear you saying, and you're gonna have to correct me. But you're saying it's possible for a dentist in 2021 to make money off of this way of doing things.
Yes.
Okay, so one of the problems that Sonya and I face a lot when we're consulting with dentists who want to go mobile or who are thinking about it, it's that learning curve. It's that first step of like, well, how do I transition what I'm doing now to go mobile? How do I transition my business model, my service model? So what's Melissa, that first step?
I love that question. I think to me, my commitment is in my office space here at Victorious Dental here in Middleton, Wisconsin. thedrillisgone.com. I'm committed to no drill. So this practice is probably the first in the country with no drill, no shots, pretty much no rent or no building expense. I mean, you can set this up almost anywhere. But your question was, okay, well, what is a general dentist going to do who's already got a busy practice and to pivot in this direction? My suggestion is, I would form a satellite clinic somewhere. Or if you want to do it in your own office, that's a little harder, but to me, the bang for the buck is the commitment to the no drill. Like, I'm afraid that if I were to teach this to 20 dentists, they're always going to pivot. Like, they're going to go, yes, I can heal cavities, but wow, I could just put a drill through this and like nothing, make, hundreds and hundreds of dollars. So that's always going to be battling. And I don't want people to default to the drill. So, and I want the public to have the confidence to know that I'm going to a place that has no drill. So they are committed. They're going to do everything possible to heal this decay and not cut it out.
That's good.
So I guess I would say satellite clinic and start there. And if you want to do it in your own practice, yeah, but I swear it's too conflicted for dentists to try to live in both worlds. There's this healing space, which to me is a brand new lane. Like, come into my lane. And here's why what I think it's the best. Like, my background is in oral systemic, right? With the American Academy of Oral Systemic Health, I've been involved with that forever. And so I love that space. And yet I see all my colleagues struggling, like, how do I work with doctors and how do I bring this into my practice? I'm already got root canals and extractions to do and I know do a denture, but now I got to sit down and talk to somebody about how this is connected to that. I'm hoping my hygienists are doing it anyway. So what about coming into this space where it's like, I'll turn your back on all of that. Just try this on people for a minute. And all you're doing is creating a new lane. We're born healthy. Let's stay healthy. So let's take those people that are born healthy, for the most part, and keep them in that lane. How do we stay in that lane? We never touch a drill to their teeth, because that's a downward spiral that leads to thousands of dollars over time, all kinds of heartache and discomfort and tears, and forget it. Keep them in this lane. Help them be responsible for their own personal health. What a better lane to be in when you're now saying, look, we've done this for you dentally. Now we're going to do it for you systemically. Now we're into this wellness piece that fits where the diet fits in, stress reduction fits in, exercise fits in, and here's this piece. And then we're going to do early screening in this piece as well. So that we're going to look for the things that are going to take you out early, off the planet early, like die. We're going to look for those early because the medical community is not looking for them early. Your primary care physician is not looking at your carotid arteries like I am, is not necessarily looking for a C-reactive protein, which is the crystal ball of your overall systemic inflammation. They're not looking for that. They're not doing a saliva test, looking for the pathogens that can lead to plaques lining up in your arteries and leading to stroke or heart attack risk. They're not. Here's the thing they're not doing. We're all concerned about our weight. They go, oh, well, your body mass index is this or that. It's like, well, that's not even the best thing to look at when we're talking about your weight. What we care about is the weight that's wrapped around the organs that are trying to keep your body alive. That's called visceral fat. And you can't get that from a waist measurement. You could have lots of visceral fat and almost no, or you could have lots of subcutaneous fat and maybe no visceral fat, or you could have a nice waist measurement, but until you go deeper and see, well, what kind of visceral fat do you have? You could be skinny fat, meaning that you could have dangerous, well, that's a term we use. You could have dangerous fat clinging to your organs, making your body struggle to stay alive, but it happens quietly. You don't know that. So primary care docs should be looking for that. But anyway, this is the screening that I do in my dental office.
Mm-hmm. I'm going to have to look into that because my cholesterol is through the roof. And I'm like, I'm a vegetarian. This is TMI, isn't it? But it's like, what is going on? So I'm either going to fly out to see you and you can do all that testing on me.
It may be worth it, Em.
Yeah, I know, right? It's like freaking me out over here.
And Doc, something that when I hear you talk, this form of dentistry is not for everyone, but it's for the dentist and for the practice that cares about the whole body and cares about the whole health. And this is what dentists have been screaming. We've been screaming this for years. We want you to connect your mouth back to your body.
Right.
And if we're saying that, we have to live that. And in today's society, like Melissa said, so many people are trying to eat healthier, trying to exercise more. And our whole world just went through a pandemic. So now more than ever, it's time to think about the whole body health. Right. And every part, every Every medical person that deals with you can look at that, from your dentist to your podiatrist to your ophthalmologist to your audiologist. It's a wholesome, a whole world, a whole body treatment.
It's one
So
body. Yeah.
exactly. And so the dentists that want to adopt this, it's going to be the one that cares about the whole patient. Now, one thing while you're talking, and I hope that our audience hears this. This is something that, and you brush past this, Doc, but I have to horn in on this just because
Come
of
on,
the nature of who I am. This
please.
is something that the hygienist can focus on.
Oh, yes,
Now,
absolutely.
the hygienist will buy this quicker than a dentist will. And you can talk to this to your dentist.
Yeah.
And something that you said, Doc, about the satellite office. This is perfect to have your hygienist maybe doing this. And if
Amen.
you're even apprehensive about starting, start with kiddos. If you don't want to
Yeah.
put silver diamond fluoride on an adult tooth, which I love for nursing homes, it's the best for our aging adults who have rampant decay at the gum line.
Yeah.
Start with the kiddos, and the
Yeah.
hygienist can do it. If you and just see how much production she brings in,
Oh, yeah.
doing pro feeds and sealants and silver diamond fluoride. Let her do that. Give her a lane. Let
Yeah.
her take the training, and then compare your books after a year or 6 months, and you'll see how and especially if you could start with the kids treating their whole body. Then
Yeah.
what do you say, Doc?
I say that's the lane. That's the lane to jump into. Stay in that lane. But I appreciate you, Sonya, because you're so caring about the dentists out there. And right, it's like, I'm not doing this for the dentists. They're the last one to come to the party. I'm doing this for the people. The people need this. So hygienists that, there's Elijah's website called, or a big Facebook forum called Trapped in an Op. Like, a lot of people have been hygienists for a long time, really looking to do something else. But you know what? If they could become lifesavers and life improvers and wellness deliverers and do a whole different model. And you know what I fear for hygienists? How horrible is it for them to always send their little baby patients off to slaughter? Off to slaughter is what I'm saying, because right, dentist comes in, diagnoses 5 cavities, and they see that little baby that appointment's going to be, shot, drill. And it's like, and they know they could have healed those spots. So
Wow.
that scares me. It bothers me. So I'm doing this for the people, and it's the people that have to be educated. Yeah, yes, there'll always be very proactive and progressive dentists, hygienists, way more in that space than the dental profession. Look, I've been in the American Academy for Oral Systemic Health for over 10 years, and it's the hygienists that drive that whole thing, because they're the ones on the front lines of the battle of disease. They're the ones that are talking to the patients, spending more time with the patients. They see that disease on the front lines, whereas the dentist may come in and it's like, well, I was cutting a bunch of preps. I guess I'll come in here and do a checkup. Just tell me what's going on, I mean,
It's so
listen,
silly.
I'm
You
just being,
are silly.
I'm going to be honest. I've been that dentist, and it's hard to shift gears. I've done upwards of 100 preps of veneers in one day. I'm just going to put that out there. I'm just saying, like, and that sounds like a mill, but I had a system and I had a lot of help, and I just did the prepping, and I had a team, and we, but the point is that when you're really in that mode as a dentist, and you've got like a few crowns to prep or whatever, it's like driving a race car, and you imagine the intensity and focus that the race car driver has to have, because they got to round that bend, and they got to keep that car from flipping, and they don't want to crash into somebody. So they're like so focused. Dentists are focused too, bless their hearts. That's good. They got to be focused. Then all of a sudden, someone throws up the red flag. Wait a minute, I was going 200 miles an hour. I'm about to take that turn. I can see exactly what I want to do. And all of a sudden I got to park my brain and my energy and excitement for the procedure that I'm doing over here and go in and check my hygiene patient, right? Have you ever experienced somebody coming in the room like that? Like, I just got to get out of here as quick as I can. But then I started getting passionate about the oral systemic connection. I stayed longer in the hygiene checks than I should have. And the hygienists started doing this, tapping their watch and going like, they make that thing like, would you hurry up and get out of here? It's like, I can't help it. I'm passionate about this. We can save people's lives. But the point I was making is that sometimes dentists aren't patient enough to learn all this, to want to get involved in it. They're driving that race car down, down the track. And this is a pivot. This is a shifting gears in the brain. It's hard to do.
And you know what? Yes, you're exactly right. And I'm really sad because we have to wrap now, but you're exactly right. We've got to start thinking outside the box. And I think some of what you're alluding to is that dentistry of the future is going to look different than what it does now. And I think maybe COVID was a good pivot point, or maybe SDF and all the new technologies that we're learning can help with this.
Right.
But I do think that a lot of those folks who are listening are pioneers and have been aiming you this entire
Bless you,
time.
people out there that are pioneers. Melissa and Sonya, do you have any kids?
Yes.
You have kids. Okay, good. So let me just put it this way: this new concept, this dental office with no drill. Where would you take your child for their first visit? To the place that sees every little tiny little spot as a cavity or decay as a cavity that needs to be drilled and filled, or to that lane where it says, no way, I don't have a drill here, no shots. We're going to heal that decay. That's going to be the best thing. Stay in this lane, stay healthy, stay well. I mean, to me, the choice is obvious.
Mm-hmm.
But I'll let you guys answer that question. Which lane would you go in?
I mean, obviously the choice is obvious. And I think too for the patients,
You still work for some dentists, by the way? Gotta be careful. Gotta be careful with what you say. So, okay, I get it. I understand.
But I think too, there's a learning curve with the patients as well. So, okay. So here's the plan. Let's come up with a plan.
Let's get a plan going.
Because I know we could talk for hours about this, but let's do this. Let's have you come to our conference in Las Vegas
Would love
in
to.
March, and let's have you do a deep dive on this. What do you say to that?
Yes.
I would love to. I'll show everybody.
Could you do hands-on? Could you do hands-on?
Yeah, absolutely. I could do hands-on.
You could do a
show you the
workshop.
logistics. I could set up my whole clinic in your space. Like,
Yes.
I love
how
that.
hard is that?
Yes.
And then show people how to do it without the air, without the pressure, the plumbing,
That's
it's
truly
so
mobile.
doable.
That's truly mobile.
You're not going to get much more mobile than that. And I'm not going to amputate any tooth structure. I'm going to heal. And it's the kindest, most humane way to treat patients. It's the lane I'm opening up. Come join me at the Mobile Dental Conference. When is that coming? I think I got it in my calendar. When is that?
You have it. It's March.
Everybody knows.
It's March 3 through 5, 2022.
Well, I'm there. And I'm going to make a big splash, and I love it. And and thank you for having me on, Sonya and Melissa. Thank you for doing what you're doing. I appreciate what you're doing in your space. We're going to change the world, and that's what's exciting. So, and if people want to say that's dentistry gone wild, then it was about time dentistry got wild, because that's what we're doing.
Dentistry should have been wild. Doc, how can people get in touch with you if this podcast has made you think that, hey, I want to introduce this to our office, I want to introduce this to my mobile practice? Yeah. But I need to learn more about this. I love this man's energy. What he's saying resonated with me. Well, how can someone get in contact with you?
You can find me at thedrillisgone.com. That's
crazy.
Just one word, but it's 3, the drill, 4, thedrillisgone.com. That is my office website. And there's a registration page at the bottom of that page. So scroll to the bottom and fill it in and tell me you want to learn more, and I'll be happy to share. I've got dentists. I'm training dentists at the end of the summer. I'll be training dentists at your meeting, at your conference. So this is something that's going to happen. It's not going away. The science is getting stronger.
It's not going away.
No, it's not going away. And the conflict will be with the ADA and some of these other organizations in dentistry, because they sort of exist to keep everybody happy. But when my lane starts, when people start moving into my lane, that's going to make the traditional conventional dentists really concerned. But they have no choice, because the people are going to demand it. And Sonya and Melissa are going to be bringing it to the people, courtesy of the big meeting in March.
There we go. I'm wondering, Sonya, if we can get him on like the middle of a stage and have the stage rotate. You know what I mean?
Oh, wow.
I wonder. I don't know. We might have to find a sponsor for that.
Got to figure out something, because he needs all the energy in the room.
Yes. If it's, you know what, this is so easy. I can even do it upside down. So if you get me in one of those hamster wheels, Strap me
You
in
are
a hamster wheel,
crazy.
and I will show you how easy it is. And here's the other beautiful part. Hygienists, you're going to be doing this out there, and we can even train our dental assistants to be delivering this care. This is the care that the people need. This is what the people demand. Sadly, they don't know about it. They're going to hear about it. We're going to be making a lot of noise. Thank
I
you for-
love it.
and that's as wild as dentistry needs to get to reach the people, to get their attention, to save their lives.
This dentist is saving lives. Thank you. Thank you, Doc, for being on the show. And thank you to everyone listening to this podcast today, the official podcast of Mobile IntelliDentistry, Dentistry Gone Wild. Listen,
Woo!
we've
Yes!
been talking about it all day. We're excited to see you March 3 through 5 in Vegas.
Come out,
Velocity
people.
in
We got-
Vegas.
Oh, we got things to do.
This guy, he's going to be there. He's
I'm
going to be there.
and what I can do on the dance floor and on the stage, you got to see that too. I mean,
dance off, dance off, dance off,
Right?
dance off, dance off.
Oh, dance off. You bring it. Just bring it. All right.
Thank you all for listening. Click, like, and share. Subscribe. Subscribe to our channel. And if you know anybody who wants to do dentistry without a drill,
There you go.
this is the guy. Thank you. Goodbye.
See you next week.
Thank you.